Hello and welcome to our YouTube channel. We share different information related to Canadian immigration in English, French and Kinyarwanda. On this channel, we only use English and French to reach those who do not understand Kinyarwanda. However, today we are not talking about immigration. We're talking about an opportunity for Canadian health professionals who have been waiting for a smooth process to practice in Ontario. This is the second largest province in Canada after Quebec, and almost half of Canadian population live in Ontario. Did you know that Ontario is removing labor mobility barriers to allow health professionals from other provinces to easily license in Ontario starting January 2026? Let's start with a small scenario. Maria finished her shift at a busy Calgary hospital. Her mind already jumping across the country, she stared at a map, picturing the long drive from Alberta to Northern Ontario. Her elderly mother, in a small town outside Thunder Bay, had taken another fall. The local clinic was short-staffed again, and the wait to see a doctor, let alone a specialist, stretched into weeks, then months. An experienced critical care RN, Maria looked up how to transfer her license to Ontario. The forms, the fees, the redundant verifications, and the uncertain timeline felt like a mountain. She was ready to move, to care for her mother, and to feel a desperate need. But the system, it seemed, was not ready for her. A qualified nurse in Alberta, a paramedic in British Columbia, or a lab technologist in Nova Scotia is not automatically ready to work in Ontario. Not due to skill or dedication, but a patchwork of provincial rules that restart the process. Bureaucratic friction creates delays, fuels shortages, and leaves patients waiting. The change coming in January 2026 is designed to dismantle these walls. A fundamental shift. Think nationally about our healthcare workforce. As of right recognition, in good standing, professionals can start working without lengthy re-credentialing. It is a pragmatic response to staffing shortages, straining our hospitals and clinics. For patients, shorter waits and better access. For workers like Maria, the freedom to go where they are needed most. Beyond red tape, it is about resilience and national solutions. The stakes are high, but the cost of inaction is higher. To understand 2026, we must appreciate the labyrinth of the current system. Each health regulatory college applies its own licensing rules. The Canadian Free Trade Agreement supports mobility, but practice has not been seamless. Physicians file full applications, degrees, training, conduct certificates taking months. Provinces built localized checks like Ontario's jurisprudence exam. Over time, parallel systems created subtle but significant differences. A fragmented landscape relitigates credentials at every border. Experienced clinicians reapply, gather transcripts, seek letters, then wait. 3 to 6 months, sometimes more, unable to work. The healthcare system loses talent when it needs it most. Labor mobility barriers are significant and solvable. The core problem, the belief that local standards are uniquely different or superior. Each regulator has distinct entry rules, QA, and codes. Intention is sound, but the effect is duplication. Ethics, safety, and competence do not change at the river. We trust national accreditation and the Royal College's training standards, yet specialists face re-examination when crossing provinces. It is like carrying a national passport but needing a new visa for Ontario. CSMLS confers national certification, yet Ontario requires separate registration. Paperwork delays leave labs understaffed. Already vetted professionals wait while patients wait longer. Silos waste effort revetting rather than improving oversight. Patients do not care if training was in Toronto or Edmonton. They care that clinicians are competent and available. Current rules are slow, cumbersome, and ill-suited to a mobile workforce. It is a web of our making. 2026 changes begin to untangle it. As of right, licensing rewires Ontario's approach to mobility. In good standing, licenses from any province must be recognized. No retraining, no extra hours, no repeat examinations. The core principle is recognition and trust. The change spans a wide range of regulated health professions. Good standing is essential. Active restrictions are not permitted. Focus shifts from revalidating credentials to verifying status. For Maria, the path to working in Ontario becomes simple and fast. She provides proof of a current active license and a letter of good standing. CNO issues an equivalent license promptly. The wait shrinks from months to days or weeks. A jurisprudence module may be completed after licensure. She starts working much sooner. The system re-engineers for speed and efficiency. Regulators are asked not to re-adjudicate qualifications but to facilitate mobility. A move toward unified practice and faster care. Skilled hands get to patients faster than ever. Healthcare professionals benefit fast freedom from bureaucratic purgatory. Moves become less stressful, less uncertain, and quicker. Employers gain a national talent pool. Northern and rural sites fill vacancies faster and more stably. Faster hires mean shorter waiting lists. Surge capacity reduces cancellations and improves outcomes. Access is driven by patient need, not provincial lines. Simplification frees regulatory resources. More focus on conduct, QA, and complex international cases. Strengthening integrity while improving access. Everyone gains when care moves faster and safely. A flu outbreak overwhelms a city hospital. Many staff are out sick. Before, emergency orders and workarounds. Now, put out a call. After quick verification, help arrives within days. Rapid deployment builds resilience the system lacks today. Underserved communities become more attractive to talent. Reduced licensing delay makes lifestyle-aligned moves viable. Stability improves services and keeps doors open. Workforce can flex with shifting demand. Other federations show mobility improves access without harming safety. Ontario aligns with modern integrated workforce management. One country, shared need for accessible, high-quality care. Benefits are compelling, but risks exist. Quality assurance and safety. What if standards differ or drift between provinces? Oversight must be seamless when complaints arise. Data gaps must not let history slip through cracks. Build robust, real-time interprovincial verification. Speed cannot replace diligence. Accuracy is essential. A layered safeguards model is critical. Standardized digital exchange of full regulatory history. Targeted modules ensure local readiness without delay. Mentorship adds real-world oversight where needed. Continuous monitoring spots issues early. Success requires a clear, coordinated roadmap. Create a secure national platform to verify status and discipline in real time. Agree on data standards and secure exchange protocols. Without it, fast verification remains elusive and risky. Colleges must shift from heavy document reviews to targeted status checks. Set service standards, for example, 5-10 business days for complete files. Employers ensure safe start with standardized local onboarding. Reassure the public. Speed with safeguards and transparency. Report volumes and monitor safety metrics. Independent reviews refine the system as it matures. Gatekeepers become facilitators without losing public trust. The EU's automatic recognition shows what mutual trust enables. Harmonized standards and accreditation underpin mobility. A secure regulator-to-regulator network makes it safe and fast. Ontario needs a similar digital backbone before 2026. Australia's automatic mutual recognition reduces red tape. Professionals notify local regulators and remain under local law. A simple notification preserves oversight without barriers. Real-time registries aid safety and emergency communication. Light touch steps retain accountability. Adopt proven tools for speed without compromise. Build a modern, mobile, and safe system. Removing labor mobility barriers is necessary and overdue. It promises a more resilient, responsive, and integrated system. The default flips to trust and facilitate with safeguards. Better for providers and the public they serve. Policymakers must fund national data sharing infrastructure. Regulators enable mobility and guard public trust. Employers turn new licenses into effective team members. Let professionals like Maria go where they are needed without a mountain of paperwork. A future defined by collective capacity, not divisions. For context, start with Ontario's A Plan to Stay Open briefing. With collaboration, diligence, and shared commitment, care follows need everywhere. Thank you for watching, and if you find the video informative, consider subscribing to this YouTube channel. Easily get notified when a new video is released.